She had sutured a man's femoral artery with fishing line and a sewing needle in the back of a moving Humvee, somewhere outside Kandahar, with no light except for the infrared beam of a teammate's rifle scope. She had restarted a heart with her bare hands for 39 minutes while a medevac helicopter fought through a sandstorm to reach them. She held 17 military commendations, a Navy Cross, a classified service record that required Level 4 security clearance to open, and even then, large portions were redacted. Today, Dr. Marcus Hale, Chief of Trauma Surgery at Mercy General Hospital, told her to shut her mouth and get out of his emergency room. He had no idea what he had just done. She arrived at 6:47 on a Tuesday morning, 13 minutes before her shift began. Maya Chun carried one canvas tote bag and wore her dark hair pulled back in a bun that could have survived a Category 4 hurricane. She moved through the hospital's main corridor the way water moves through a complex pipe system, finding the path of least resistance, making no sound, leaving no wake. She had already, without appearing to look at anything in particular, noted the locations of both fire exits, the supply closet near Bay 4, the code panel at the staff entrance. The keypad buttons 1, 3, and 7 were more worn than the others, which told her a great deal, and the security camera with the slight eastward tilt that created a 15-degree blind spot near the medication dispensary. Old habits, the kind that didn't unlearn themselves. The charge nurse at the ER station was a broad-shouldered woman named Lisa Torres with the grip of someone who had once, in a previous life, done something that required a lot of grip. She sized up Maya the way people in high-pressure environments always sized up newcomers. Not with judgment, but with calculation. How long will this one last? Welcome to the zoo, Lisa said, pushing paperwork across the counter. You transferred from County General? Yes. How long were you there? 8 months. And before that? Maya filled in a checkbox without looking up. Federal service. Lisa let the silence sit for a moment, then decided not to pull on that particular thread. People who said federal service in that particular tone of voice were usually either incredibly boring or incredibly interesting, and either way, they'd reveal themselves eventually. Trauma bays through there, Lisa said, pointing. Dr. Park is your attending today. Good people. Dr. Hale is. She paused, the way someone pauses before describing a minefield. Also present. I see. You don't. Yet, Lisa said. But you will. Dr. Sarah Park was 33 years old, Korean-American, and had the particular energy of someone who had decided, at some early age, that competence was more interesting than politics. She shook Maya's hand, glanced at her transfer file, and said, without preamble, County General says you have exceptional airway management. Someone there called it eerily calm under pressure. I'm going to need to know if that's true. It tends to be true, Maya said. Park studied her for a beat. Most new hires, at this point, would have smiled, looked eager, or over-explained. Maya Chun did none of these things. She simply waited, with the complete stillness of a person who had no need to fill silence. Interesting, Park thought, and assigned her to Bay 3. Maya had been on shift for 47 minutes when Dr. Marcus Hale made his entrance. There was no other word for it. Entrance. He came through the double doors with the gravity of a man who had long ago confused his professional environment for a stage. He was tall, with a surgeon's hands and the kind of face that photographed well in hospital brochures. His white coat was pressed. His watch caught the fluorescent light in a way that suggested the catch was intentional. 3 residents followed at a calculated distance, close enough to be associated with him, far enough to avoid the blast radius when he was displeased. He stopped at the nursing station. He looked at Maya, who was reviewing a patient's chart. A 44-year-old male, chest pain, a typical presentation, whose blood pressure had done something in the last hour that Maya found quietly concerning. You're the new nurse. She looked up. Maya Chun. Yes. Why are you reading that chart? Getting familiar with Mr. Donnelly's history before I. That's not your job. He took the chart from her hands with the smooth, unhesitating confidence of a man who had never experienced the discomfort of being told no. Your job is to execute physician orders, maintain patient comfort, and stay out of the way of people who are qualified to make clinical decisions. Is that understood? The nursing station had gone very still. 2 residents looked at their shoes. Lisa Torres, 3 feet away, had developed a sudden intense interest in a supply cabinet. Maya looked at Dr. Marcus Hale for exactly 2 seconds. Understood, she said, and turned back to her medication tray. There was something in her voice, or more precisely, in her lack of voice, in the complete absence of the flinching or the apology or the wounded expression that he was accustomed to producing, that made Hale pause for a fraction of a second. Then he swept away toward his rounds, trailed by his satellite residents. Lisa appeared at Maya's elbow so quickly it suggested she had been waiting. You okay? Yes. Most new nurses, he makes them cry on day one. Sometimes by 8 a.m. Maya capped a syringe with calm precision. He's not the first person to tell me I don't belong somewhere. She did not say. The last person who told me that was a Taliban commander who had her pinned down in a drainage ditch outside Helmand province. He was wrong, too. Marcus Hale had been the most decorated surgeon in Mercy General's history for 11 years, and he wore that distinction the way some people wear armor, not as protection, but as a weapon. He had been first in his class at Johns Hopkins. He had done his residency at Mass General. He had published 37 peer-reviewed papers, delivered keynotes at 4 international surgical conferences, and appeared twice on the cover of Medical Excellence Quarterly. He had a brother on the hospital board of directors, which was, perhaps, not coincidental to the remarkable consistency with which his errors were overlooked and his successes were amplified. He was also, by any fair accounting, a good surgeon. That was the thing that made him complicated, the thing that made his behavior easier for the institution to dismiss. He could not be wrong. The results said so. The results, carefully curated and selectively presented, always said so. What the results did not say, because numbers were cooperative in ways that people were not, was that Dr. Marcus Hale had a habit of dismissing information that contradicted his initial diagnosis, that he had a documented pattern of interrupting nurses mid-report and missing the second half of the data, that 3 patients in the last 4 years had experienced complications that a faster or more humble response might have prevented, complications that had been quietly absorbed into the hospital's statistical noise, with the assistance of James Hale's position on the board's quality committee. What the results also did not say was that Dr. Marcus Hale was, above all things, terrified. Not of surgical complexity, not of blood or pressure or the long grinding hours. He was terrified of the day someone walked into this hospital who was simply, demonstrably, inarguably better than him. He didn't know the day had already arrived. The second incident came on Thursday. A 20-year-old construction worker named Reyes had come in with a forearm laceration, messy, deep, and already bandaged by a well-meaning coworker with what appeared to be a strip of someone's t-shirt. Hale looked at it briefly between 2 other consults and ordered standard wound irrigation and closure, then moved on. Maya was the one assigned to prep the wound. She unwrapped the makeshift bandage, assessed the injury for approximately 8 seconds, and then walked calmly to where Dr. Park was charting. The Reyes laceration in base 6, she said quietly. The wound trajectory suggests involvement of the flexor digitorum profundus tendon. He's reporting numbness in digits 2 and 3. I think it needs imaging before closure. Park looked up. She looked at Maya. She said, "Show me." 40 minutes later, Mr. Reyes was in surgery to repair a severed tendon that, had it been stitched shut without proper alignment, would have cost him the use of 2 fingers. No one announced what had happened. Maya returned to her station and began preparing the next patient. But Park watched her from across the room, filing away a question she didn't yet know how to ask. The third incident was the one that broke the surface. Bay 2, Friday afternoon. A woman in her late 50s, post-operative day 3 following an abdominal surgery performed by Hale's team, presenting with acute confusion, escalating fever, and a respiratory rate that had climbed 12 points in 2 hours. The resident on duty, a nervous third-year named Dr. Patel, had charted it as possible UTI and ordered a urinalysis. Maya walked into the bay, took one look at the patient's coloring, her breathing pattern, the way her hands were curled, and felt the cold, specific recognition of a body in systemic crisis. She found Patel at the charting station. "Dr. Patel, Mrs. Gomez in Bay 2, have you assessed for sepsis?" Patel blinked. "It's most likely a urinary. Her MAP is 62. She's tachycardic at 118. Elevated lactate from this morning's draw that I don't see a response to charted." Maya kept her voice even, non-accusatory, clinical. "I'd like to flag this for sepsis protocol." Patel hesitated, then nodded. "Oh yeah? Let me get Park." Hale walked past at precisely that moment. He had been briefed on Mrs. Gomez an hour ago and had signed off on Patel's assessment. "Is there a problem, nurse?" The word nurse landed like a stone on glass. "I believe Mrs. Gomez may be in early septic shock. I've asked Dr. Patel to." "Mrs. Gomez," Hale said, picking up the chart with the authority of a judge reaching for a gavel, "is a post-op patient with a common presentation of surgical site infection. Dr. Patel's assessment is correct, and I reviewed it myself this morning." He set the chart down. "I don't remember asking for a nursing second opinion." "I know," Maya said. "I'm offering it anyway." The silence that followed was the specific, pressurized silence of an immovable object being asked to consider the existence of other forces. "Get back to your station," Hale said, quietly and with great precision. "If I see you interfering with physician assessments again, I will have you removed from this floor." He walked away. Maya stood at the charting station for exactly 3 seconds. Then she picked up the phone and paged Dr. Park directly. Mrs. Gomez was transferred to the ICU within the hour. Her lactate had continued to climb. By the following morning, she had been stabilized on vasopressors and broad-spectrum antibiotics. She survived. She would not have survived the night without intervention. Dr. Hale was not informed of the nurse who had initiated the flag. But Dr. Park knew, and she went home that Friday night, opened her laptop, and tried, again, to access Maya Chen's full employment record. The federal system returned the same response it always did. "Access denied. This personnel file is protected under the Special Operations Personnel Privacy Act, 10 U.S.C. Section 130B. For authorized inquiry, contact the Naval Special Warfare Command, Coronado, California." Park stared at the screen for a long time. Then she poured herself a glass of wine and thought, "What in God's name did you do before this, Maya Chun?" 3 weeks into her tenure at Mercy General, Maya Chun had developed a small, quiet mythology around herself. The nurses knew she could start in 4 in a moving elevator on a pediatric patient without bruising. The residents had noticed that whenever she suggested a differential, she was, with unnerving frequency, correct. The overnight staff had spread a story, possibly exaggerated, but not by much, about the night she had talked a suicidal patient through a respiratory crisis for 40 minutes using nothing but a calm voice and a hand on the patient's wrist, never once calling for backup or sedation, and then gone straight back to charting as though nothing had happened. She didn't talk about herself. She didn't explain her background. She bought coffee for the overnight staff and remembered how everyone took it. She was never late. She was never flustered. She once, during a fire alarm drill that created 40 minutes of controlled chaos in the ER, quietly continued to work because she had assessed the alarm's location, the wind direction from the building's intake, and the probability of actual threat, and made an independent determination that it did not warrant evacuation of her patient. She was right. Lisa Torres had taken to watching her with the specific attention of someone trying to solve a puzzle she hadn't been handed the box top for. She watched the way Maya moved through a crowded trauma bay, always with her back toward a wall, always facing the entrance, always knowing where the exits were. She watched the way Maya handled the rare moment of genuine emergency. No acceleration, no visible adrenaline spike, just a quiet, total engagement, like a machine shifting into the gear it was actually designed for. One afternoon, between cases, Lisa sat down next to her at the break room table and said, without preamble, "Military, right?" Maya looked up from her coffee. "Why do you ask? You sit with your back to the wall. Always. And when Hale screamed at you last Tuesday, you breathed in for 4 counts and out for 4 counts. That's a tactical breathing technique. I know because my brother-in-law does it, and he did 2 tours in Iraq." Maya was quiet for a moment. "Army," Lisa pressed. "Navy." Lisa waited. "Corpsman," Maya said, and stood up to return to the floor. It wasn't a lie. It just wasn't the whole truth. She had been a Navy corpsman once, for about 3 months, before she had finished medical school at 24, completed her residency at 27, and been recruited into a program that did not advertise itself. He came in on a Wednesday afternoon, arriving by ambulance from a highway accident, though anyone paying attention would have noticed that the paramedics who accompanied the gurney carried themselves with a specific, quiet alertness that civilian first responders didn't typically possess, and that the man in the second ambulance, The one who had arrived simultaneously and stood at the ER entrance with his arms crossed and his eyes scanning the perimeter, was not a relative. His name on the intake form read, Briggs, Thomas W. Age, 24. Occupation, security consultant. He had multiple penetrating injuries to the abdomen and right flank, the kind of wound pattern that, to anyone with combat experience, looked less like a highway accident and more like fragmentation from an improvised explosive device. His blood pressure on arrival was 88/54 and falling. His GCS was 14. Marcus Hale swept into the trauma bay with the particular confidence he reserved for high-visibility cases. Complex trauma. Young male. The kind of case that ended up in presentations. He assessed quickly. His eyes went to the imaging, to the vitals, to the wound pattern. Penetrating abdominal trauma, likely bowel involvement, he announced, already moving toward the scrub sink. We're taking this 2 or 2. Start 2 large-bore IVs, cross-match for 6 units, and get me a CT if his pressure holds. Maya was in the trauma bay assisting. She had been watching Tom Briggs's face since the moment the gurney came through the door, the subtle asymmetric rigidity in his abdominal wall, the way he was breathing shallow and fast, the way his pain response when she pressed his left lower quadrant was different, profoundly, specifically different, from what the wound pattern alone would predict. She had seen this before. Not in a hospital. In a tent. In a drainage ditch. In the back of a vehicle moving at speed through terrain that wanted to kill everyone inside it. She stepped toward Hale. Dr. Hale. His left lower quadrant rigidity is disproportionate to the external wounds. Combined with his pressure and the rise in compartment pressure I'm reading on palpation. She kept her voice measured. I think we need to consider abdominal compartment syndrome. Hale didn't look at her. He has penetrating trauma. Compartment syndrome is a post-op concern. It can occur acutely in high-energy trauma, especially with shut the FCK up, nurse, asterisk. It came out loud. Louder than he'd intended, perhaps. Loud enough that the entire trauma bay, nurses, residents, the paramedics near the door, went perfectly, absolutely still. Hale didn't register the silence. He was already moving. Or 2, he said. Now. In the waiting area near the ER entrance, a young man in civilian clothes had been sitting perfectly still for 12 minutes. He was 26, compact, with the kind of physical stillness that came not from relaxation but from training, the ability to be motionless because you had decided to be, not because you were tired. His name was Danny Kim. He had come with Tom Briggs because Tom had no one else to call, and because when your teammate went down, you didn't go home. He had been watching through the trauma bay window, out of habit, the way they all watched everything, until the nurse walking alongside the gurney turned her head at a particular angle, and the overhead light caught the line of her jaw, and the way she moved when she pivoted from the vitals monitor to the force stand. Economic, frictionless, controlled. His stomach dropped. He stood up. Hey, he said to the nurse passing near him. Not Maya, a different one. That nurse. In there. The one with the dark bun. What's her name? The nurse looked mildly startled. Chun. Maya Chun. What? Danny Kim sat back down. Very slowly. His hands, which were extremely steady under most circumstances, were not entirely steady right now. That's not possible, he thought. She left. She said she was gone. And then, very quietly, oh no. Or 2 was 31 minutes into the procedure when the bleeding became uncontrollable. Hale had opened on his initial assessment, penetrating bowel injury. As predicted, the first repair went smoothly. He was, by any measure, a technically proficient surgeon in his element, and for the first 20 minutes, nothing confirmed or denied anything about his earlier decision. Then Tom Briggs's blood pressure, which had been tentatively stabilized, dropped to 60 systolic. The anesthesiologist, Dr. Park, called it out immediately. Hill went back in and found what Maya had been trying to tell him about. The abdominal compartment pressure was catastrophically elevated. The initial repair had been correct for the visible injury, but the invisible process, the insidious accumulation of pressure that was now compressing vasculature, collapsing venous return, shutting down the body's own ability to compensate, had been progressing the entire time. The window for the simplest intervention had been 40 minutes ago. More suction, Hale said. His voice was controlled, but something beneath it was not. Get me. You need decompressive laparotomy, said Dr. Park. from behind the anesthesia screen. Full abdominal decompression. Now, I'm aware of what I need. But his hands, which were excellent hands that he had built a career and a self-image upon, were hesitating. Because decompressive laparotomy in this context, with this pressure, with this anatomy already disrupted by the prior repair, was not a procedure where you wanted to hesitate. And the thing about hesitation was that it had a way, in the operating room, of feeding itself. The door two opened. "I need you to stop," the scrub nurse said, turning sharply. "You can't." Maya was already at the scrub sink, her hands moving with the automatic efficiency of muscle memory, so deep it had become instinct. She pushed through the door. She was in scrubs, she had come from the floor, and she snapped gloves on with the particular speed of someone who had done this in conditions that made a heated operating room feel like a vacation. "Get out of my or." Hale's voice was controlled fury. Maya looked at the monitor, looked at the field, looked at Tom Briggs, whose blood pressure was now 52 systolic and whose body was losing the argument it was having with physics. "Make a decision," she said to Hale. "Do you want to argue about credentials, or do you want this patient alive?" Silence. A single second. Dr. Park, behind the screen, "Let her work, Marcus." Something shifted in the room. Not a sound, not a movement, just a change in the quality of the air, the way rooms sometimes change when the person with the most authority isn't the person who everyone expected it to be. Hale stepped back. What followed was not dramatic in the way that surgical moments are dramatic in film. There was no soundtrack, no camera circling for the best angle. It was quiet, and fast, and completely precise. Maya worked from a place so interior it had no name anymore. A place built from years of operating in conditions where elegance was impossible and outcome was everything. Where you used what you had and you moved without hesitation, because hesitation was the thing that killed people, not the injury. She used an approach to the retroperitoneal space she had adapted from a technique developed in combat trauma settings, minimally described in civilian surgical literature, but effective in cases of acute abdominal compartment syndrome with concurrent vascular compromise. She constructed a temporary drainage configuration with equipment already on the table. She worked with 2 instruments instead of 3 because the table geometry required it, and she had long since learned to work with whatever geometry existed. 11 minutes. Tom Briggs's blood pressure climbed to 78, then 91, then 104. The room breathed. Maya stripped her gloves off and dropped them in the waste receptacle and walked out of or 2 without saying anything, because there was nothing to say. Dr. Park's eyes followed her from behind the anesthesia screen, wide and very still, and full of a question that had been accumulating for 3 weeks and had just become unavoidable. In the Marcus Hale stood at the table with his excellent hands at his sides, looking at a living patient, and for the first time in a very long time, he didn't know what to do with himself. Sarah Park called Raymond Walsh at 9:47 that evening. Walsh was 68 years old and had been in hospital administration long enough to have developed, in place of emotions, a finely calibrated instrument for detecting problems that were about to become expensive. He listened to Park's account of the day's events with increasing stillness, and when she was finished, he said, "Pull her file. I've tried. 3 times. It's locked behind a federal privacy protection. I got a reference to the Naval Special Warfare Command." A pause. "SEAL team. I don't know." "Sarah." Walsh's voice was very careful. "What exactly did she do in that operating room?" Park described it. Walsh was quiet for a long time after she finished. "I'll make some calls," he said. He made 4 calls. The first 2 went to voicemail. The third connected him to a patient administrator at the Department of Veterans Affairs who explained, with the practiced gentleness of someone doing this for the 100th time, that she could confirm the file existed but could not under any circumstances provide its contents. The 4th call went to a number in Coronado, California, that he had received from the 3rd call as a referral. The man who answered identified himself only as a liaison officer. He asked Walsh to verify his credentials, which Walsh did. Then the liaison officer said, "Dr. Walsh, can I ask why you're inquiring about this particular individual?" Walsh explained. The liaison officer was quiet for a moment. "Is the patient stable?" he asked. "Yes." "Good." Another pause. "Dr. Walsh, I'm going to make a recommendation. I'd suggest you take no disciplinary action regarding today's incident until you've had a conversation with someone in our command structure." We'll be in touch within 24 hours. Walsh hung up the phone and sat in the dark of his office for a while, looking at nothing in particular, thinking about the woman in the oar and the way Park had described her working, like she'd done it 1,000 times, in worse places than this, and feeling, with the certainty of a man who had been reading people for 40 years, that he had missed something enormous. Meanwhile, James Hale arrived at his brother's office at 10:15 p.m. with the focused energy of a man who had decided that a problem needed to be eliminated before it had time to become a narrative. Marcus was at his desk, uncharacteristically still. "You need to file a complaint," James said, dropping into the chair across from him. "Unauthorized surgical intervention. She has a nursing license, not a surgical license. She had no right to touch that patient. She saved him. That's irrelevant to the liability question." Marcus looked at his brother. "Is it? The board will back you. That's my call to make, and I'm making it. This woman walks into our hospital and makes you look." "She didn't make me look anything," Marcus said, and his voice was strange, quiet in a way it hadn't been in years. He stopped. James watched him. "What?" Marcus shook his head slowly. "Have you seen anyone operate like that? I mean," he laughed, "but it came out wrong, incomplete. Where does someone learn to do that with 2 instruments and no prep time?" "I don't care where she learned it," James said. "I care about protecting this hospital's chain of command and our family's interests within it. File the complaint." Marcus was quiet for a long time. Then he said, "All right." He arrived at 2:17 in the afternoon on a Thursday. He came through the main entrance of Mercy General Hospital without fanfare or announcement, wearing his Navy service dress blue uniform. The full one, with the gold stripes, the warfare insignia, and the rows of decorations that, to anyone who knew how to read them, described a career's worth of extraordinary actions in extraordinary places. He was 6'2", broad-shouldered, with hair going silver at the temples and eyes that had the particular quality of eyes that had looked at a very wide variety of dangerous things and remained calm. Commander James "Ghost" Reeves, SEAL Team 6, the real thing. He was accompanied by 2 people, a young male officer in working khakis and a woman in civilian dress who moved like a lawyer and carried a leather attaché with the gravity of someone transporting something important. Behind them, holding the door, was Danny Kim, who had made one phone call from the hospital waiting room 2 days ago, and whose phone call had set this afternoon in motion. The lobby fell into a particular kind of quiet that happens when something with weight and authority enters a space. Reeves walked to the reception desk and said, calmly, "I'm looking for a nurse named Maya Chun." Maya was in Bay 4, changing a dressing on a post-surgical patient, when Lisa appeared in the doorway with an expression Maya had never seen on her face before, a compound expression made up of approximately equal parts disbelief, awe, and the specific delight of someone watching a movie reach its most satisfying scene. "There are Navy officers at the front desk," Lisa said. "Asking for you." Maya's hand stilled on the bandage roll. A single, brief moment, the kind of stillness that has nothing to do with surprise. "Tell them I'll be a few minutes," she said, and finished the dressing. Dr. Raymond Walsh had been summoned to the lobby by his assistant at 2:19, in the same moment that James Hale was walking through the hospital with a printed copy of the formal complaint he intended to file with the State Medical Board. The complaint cited Maya Chun, RN, license number 4471892, for unauthorized surgical intervention in violation of nursing scope of practice regulations. It was thorough, well-written, and had been reviewed by the Hale family's attorney. James Hale reached the lobby at 2:23, complaint in hand. He stopped. The lobby of Mercy General was not large, but it felt very large in that moment. Commander Reeves stood near the center of it. He had attracted, by the gravity of his presence and the formality of his dress, a loose audience. Nurses on break, a cluster of residents, 2 attending physicians who had emerged from the corridor. Walsh had arrived. Dr. Park stood near the hallway entrance. Several members of the administrative staff had found reasons to be nearby. Maya Chun walked in from the ER wing at 2:24. She was in scrubs. Her hair was still pulled back. She looked, by every visible metric, exactly like what she had said she was. A nurse, coming off a shift, not particularly hurried. Commander Reeves turned when she entered. He came to attention. He raised his right hand, in the precise and deliberate motion of a man delivering something that means what it means, and rendered a full military salute. The lobby was silent. Maya Chen stopped walking. She looked at James Reeves across the lobby, and for the first time since she had arrived at Mercy General, the careful composure of her face shifted, slightly, into something that was not quite a smile, and not quite grief, and was deeply, privately human. She straightened, and returned the salute. "Commander," she said. "Dr. Chun." His voice carried clearly in the quiet lobby. "On behalf of Naval Special Warfare Command and the members of SEAL Team 6, I want to express our gratitude for your actions on Wednesday. Petty Officer Briggs is stable and has been transferred to Bethesda Naval Medical Center. He wanted me to tell you." A pause. "He says you still have better hands than anyone on the team." A sound moved through the lobby. Not quite a gasp, not quite a murmur. Something between the two. Walsh stepped forward. "Commander." Reeves held up one hand, politely but with absolute authority, and Walsh stopped. "I understand there's been a formal complaint filed against Dr. Chun regarding Wednesday's intervention," Reeves said. He turned to where the woman with the attaché case had stationed herself. She opened it and removed a document. A document which, Maya observed, had the Department of Defense seal on its header. "This is a letter from the Office of the Secretary of the Navy, along with a summary of Dr. Chin's service record, declassified for this purpose." He handed it to Walsh. "Dr. Chun holds a doctoral degree in medicine, a surgical subspecialty certification in trauma and acute care surgery, and is board certified in surgical critical care. She completed residency at the Naval Medical Center Portsmouth at the age of 27. She was commissioned as a medical officer and assigned, at her own request, to support naval special warfare operations at the age of 28. He paused. "She has performed 412 surgical interventions in combat environments. 209 of those were classified as damage control procedures under hostile fire. Her patient survival rate is 94.7%, which is," he looked at the room very calmly, "the highest documented rate of any combat surgeon in the history of naval special operations." No one in the lobby moved. "She holds the Navy Cross, the Bronze Star with Valor, the Meritorious Service Medal, and the Presidential Unit Citation." Reeves turned to the room, and his voice was still perfectly level, perfectly unemotional, the voice of a man reporting facts. "She chose to leave active duty and take a position as a registered nurse at this hospital. That was her choice to make. Her choice does not change who she is, what she is qualified to do, or what she did on Wednesday afternoon, which was to save the life of a United States Navy SEAL when the alternative was to stand by and watch him die." He looked at James Hale, who was standing near the corridor entrance with a printed complaint in his hand, and who had turned the specific color of someone who has just understood the full dimension of a mistake. "Petty Officer Briggs is 24 years old," Reeves said. "He has a daughter. She is 11 months old. Her name is Lily." He let that sit for exactly the right amount of time. "I think we're done here." The board meeting was called for Friday at 8 a.m. and ran until noon. James Hale withdrew the formal complaint at 8:17. After the hospital's legal team had reviewed the DoD letter and its attached materials and rendered their assessment in a memo whose conclusion required only 5 words: "Do not pursue this action." The board's review of Marcus Hale's record, which Dr. Walsh had quietly initiated 48 hours before the Thursday lobby scene, proceeded on its own track with the momentum of something that had been waiting for permission to begin. 3 prior incidents were examined with the particular thoroughness that institutions apply to situations in which the cost of continued oversight failure has become undeniable. Witnesses who had stayed quiet, nurses, residents, and anesthesiologists who had documented concerns 18 months ago and been told to refile them in a form that had, apparently, been filed into a void, came forward with the quiet energy of people who had been waiting. Marcus Hale's surgical privileges were suspended pending investigation at 11:43 a.m. He sat in the hallway outside the boardroom afterward, in a chair that was slightly too small for him, and he looked at his hands. They were very good hands. He had always known that. But they had also, and this was the thing he was beginning to understand, not with grace but with the slow, difficult machinery of genuine reckoning, made him believe that the quality of the hands was the whole story. It was not the whole story. Dr. Sarah Park found him there, on her way out. She stopped. She thought about saying something meaningful. She decided against it. Tom Briggs has a daughter, she said instead. 11 months old. Lily. She walked away. Walsh called Maya into his office at 2 p.m. She sat across from him in the same chair she had sat in a week ago, when James Hale's complaint had required Walsh to initiate a formal inquiry. She sat with the same composure she brought to every room she entered. Walsh set the DOD letter on the desk between them, facing her. You could have told us, he said. Not accusatory, genuinely curious. You didn't need to know, she said. You were practicing medicine without. I was practicing nursing, she said precisely. Within scope, up until Wednesday. Walsh looked at her for a long moment. Why, he said. Why this? Why here? Why a nurse, when you could have? I needed to not be a surgeon for a while, Maya said. Her voice was quiet, without self-pity or drama. I needed to be somewhere where the stakes were different, where I could do the work without. She paused, precisely as long as she needed to, without being responsible for everything. She looked out his window. The afternoon light was ordinary and clean. I didn't expect Tom Briggs to come through those doors, she said. Walsh nodded slowly. He's going to be fine. I know. A pause. The board would like to offer you a position, Walsh said. Trauma surgery attending. Your board certifications are current. Your surgical license in this state has been reinstated. The paperwork went through this morning, with some assistance from Commander Reeves's office. He folded his hands. You would have full attending privileges, your own service, and a salary appropriate to your experience. Maya was quiet for a long time. Can I let you know? She said. Walsh smiled, a small, real smile. Take your time, Dr. Chun. Tom Briggs was moved from the ICU to a step-down unit on Saturday. Maya came by on her way out. Not as his nurse, not as his surgeon, just as herself, which was still something she was figuring out how to be. She knocked on the open door. He was awake, sitting up slightly, with the look of someone who was tired but whose eyes were good. He looked at her for 1 second. Then, Doc Ghost Hands. The name they had given her in the team. The name she had carried through 212 surgeries in places with no electricity, and no supplies, and no margin for error. She pulled a chair up and sat down. Not the chair of a physician. Just a chair. How are you feeling? She said. Like someone took me apart and put me back wrong, he said. But together. He studied her. Ghost told me where you ended up. I didn't believe it. It's temporary, she said. Then, maybe. Briggs was quiet for a moment. My daughter is coming with my wife on Monday, he said. They're flying from Virginia. Lily, Maya said. He looked surprised. How do you? Ghost mentioned her. Briggs looked at the window. She's almost walking, he said. I've missed it. I keep missing things. He paused. Why did you leave? Everyone wants to know. No one asks. I lost someone, Maya said. On the table. 3 years ago. Helmand. He was 22 and he was scared, and I made a decision about resources, about what I had available, and I was right. Tactically right. Medically right. All the math said the right thing. She looked at her hands in her lap. He still died. And I kept thinking, if I had been in a hospital, if I had had the right equipment, if I had been somewhere where the conditions were in my control instead of... She stopped. So you came here, Briggs said. I came here to do the work without anyone dying from the wrong kind of wrong, she said. From the wrong conditions. The wrong environment. A pause. And then you showed up. Briggs looked at her for a long time. And you didn't walk away. No. Because you couldn't. Maya was quiet. Then no. He nodded. Ghost Hands, he said, softly, like a name being returned to its owner. She sat with him for another 20 minutes, until he fell asleep, and then she stood up, and she stood at the window for a moment, looking at the city below, ordinary, safe, full of people who lived in conditions that were not trying to kill them, and thought about Walsh's offer. About Tom Briggs's daughter. About the young man in Helmand she had carried with her for 3 years like a weight she had decided she deserved. She thought about the fact that she had walked into an operating room 2 days ago and done what she was built to do, and Tom Briggs was alive. She thought about Dr. Park, who had stood at the edge of an operating room and said, let her work. 2 words, for syllables, that had cost something to say. She took out her phone and sent Dr. Walsh a text message. I'll take the position. MC.